Hello, everyone, and welcome to today's webinar, Recent Advances in Multiple Myeloma and Their Implications for Future Development, presented by SmartAnalyst. I'm Joe Keenan, contributing editor to Fierce Markets, and I'll be moderating this webinar. Our speakers today are Ajay Chari, MD, Director of Clinical Research and Multiple Myeloma Program at the Mount Sinai Hospital, and Jaideep Bhattacharjee, PhD, and Director of Life Sciences Oncology at SmartAnalyst.
Thank you, Joe. Welcome to SmartAnalyst Oncology webinar series. This series is a new effort by SmartAnalyst where we feature talks by leading clinical investigators and key opinion leaders on important and timely topics in oncology, with a particular focus on their impact on the commercial development and clinical development of cancer drugs, both approved drugs and newer agents in the pipeline. Today we'll feature Dr. Ajay Chari from Mount Sinai in New York, a leading multiple myeloma investigator. But before we get to that, a few words about SmartAnalyst for those of you who are not familiar with the organization. SmartAnalyst is a leading pharmaceutical strategy consulting firm headquartered in New York with global offices in London, UK, and in New Delhi, India. We have been assisting clients in the pharmaceutical and biotech industries for over 16 years. While we do several kinds of projects in various therapeutic areas, such as oncology, cardiovascular and metabolic diseases, and in neuroscience, there are three core areas I'd like to highlight out here. Disease strategy, that's one, first we help companies think through their disease and indication prioritization strategies. This is what we refer to as the where to play and how to win strategies. Second, we help companies strengthen and maximize the potential of their development stage assets. We call this asset strategy by helping identify the opportunities where they should be developed and helping define their value proposition and differentiation. Finally, we also help companies strengthen their portfolios in part by assisting them with their BD&L strategies. We have done over 700 oncology projects in the last 5 to 6 years, including several projects with some of the larger pharma companies, many of whom who have marketed immuno-oncology assets, such as PD-1, PD-L1 agents, CAR-T agents, et cetera, et cetera. In addition, as shown on the slide on the bottom left, we also have an outstanding center for primary research where we have access to over 5,000 key opinion leaders, clinical trialists, community oncologists, high-volume prescribers, and payers. In addition, we also have a subscription offering. It's called Smart Oncology Tumor Insights Series, where we provide data-driven insights into the future landscape across 28 tumors, and this is regularly updated after AACR, ASCO, ESMO, and ASH meetings. We would like you to call us and set up a dialogue with us to see how we could help you with your strategic needs.